Hello and welcome to Community Watch. Today we have a fascinating discussion about COVID-19 with Dr. Gary Voccio. Stay with us. Community Watch starts now.
Welcome to Community Watch. Greg, how are you?
Just fine, Doc, and yourself?
Well, I'm okay. And you know, that question, how are you and okay, they seem to mean more now than they used to mean.
Yes, they do actually. I mean, yeah.
You ask somebody how they are, it's a serious question. But I'm glad you're okay. And I'm glad we're both okay. And being okay is what we want to focus on today with our guest, Dr. Gary Voccio, who is the Director of Public Health in the Northwest Health District of 10 counties, the busiest man I know. And this was a nice little cushy retirement job.
Right. It was for about a week or two.
Well, I want to thank you, first of all. I don't know if you are getting thanked enough for being so on top of this very complicated issue and being on our show and being interviewed constantly. We certainly appreciate you for all of that.
Well, thank you. Well, I want to say the people that need to be patted on the back are the people in the hospital taking care of the sick people with COVID, the respiratory therapists and the nurses and the doctors and our public health nurses who are out there every day with this. And they really are the backbone of this.
Now, I know earlier today, and we're taping the show on December 8th. Earlier today, you spoke to the City Commission, who were having a special meeting to discuss a mandate, a mask mandate. And you shared with them what you felt were pretty, I guess I can say, disturbing numbers in terms of actual patients in area hospitals with COVID. Could you kind of tell us about that for folks who may have missed that meeting today?
Sure. Well, I have my pad here with the numbers on it, if you'll forgive me while I kind of glance down. Over the past couple of weeks, Floyd County has had a positivity rate of almost 16%. You know, some of that is just a data dump where we collect the data from the specimen collection sites and it gets into the system and it's all of a sudden present there for us to look at. But I really think it's quite high, at least 15%. In the past few days, we've had a 19% positivity rate for Floyd County. And all of our counties in Northwest Georgia have double-digit positivity rates, save for Dade County, which is around 9%. But what also we're seeing are other epidemiologic numbers that are very worrisome, and that are flattening the numbers to make it equitable for all counties, all our 10 counties. Is that Floyd County's numbers are about over 500 cases per 100,000 population. Dade County is in the 300 or 400 per 100 population. Paulding's is the same, very high numbers. What that means is we still have very widespread community transmission of the virus. In our hospitals, fortunately, have plenty of ventilators to take care of the sick individuals with COVID, but the numbers that they're experiencing are very high. Wellstar Paulding has 171 patient beds available, and 42 of the patients are with COVID. They only have 4% of their critical care beds available. Adventist Hospital has no critical care beds available as of this morning. 21 COVID patients at Adventist Hospital out of 53 hospital beds. Floyd Medical Center has 327 hospital beds, and 63 of their patients are COVID patients. I mean, those are very worrisome, disturbing numbers. You know, and they're not going to turn people away. They're going to continue to care for patients as they show up. And you know, like I said earlier in our talks, you know, they are going to continue to do their patient care. Their surgeries are still being scheduled, but if these numbers get any worse, you know, there may be delays in some things that need to be done for patients, possibly. Your knee surgery may need to be held off a little longer. Other types of surgery like that may need to be delayed. So that's the trouble with having these high numbers, that we're going to overburden, and really our capacity to care for people is going to be extremely limited. These numbers are very high. They're very worrisome. And we've had 84 deaths in Floyd County. And we just don't want to see any more people die from COVID-19, but we will see more deaths. People just aren't wanting to wear masks and physically distance, and it's very disheartening to see these numbers too.
Dr. Voccio, I'm listening to you, and you're talking about how the numbers are high. I don't dispute that at all, but my question is part of the problem, because the numbers may be high, but are they relatively small when you look at the overall population? So
no, Greg, see, that's that statistic that I was given to you per 100,000 population.
Mm-hmm.
So each county in the state of Georgia, each county throughout the country is given that statistic per 100,000 population.
Okay.
So everybody is on the same plane. It's all equal. And we like to see that number below 100 per 100,000, but we haven't been at 100 per 100,000, Greg, in months. And that's why the number of over 500 per 100,000 is really a very high number. Some of the counties in the metro area are much less than that. I think Cobb's is 200 per 100,000 population. So those numbers over the 100,000 give you a better view of how bad it is here in Northwest Georgia.
But taking that, and when you say 500 for every 100,000, that number 500 now for a virus, that's crucial. But from a person just looking from my perspective, I'm just wondering if people still don't see that as a high number. So therefore, if you're not directly affected by someone you know or love, then it's really not real for you.
Yeah, it has no relevance to you. Yeah, I understand. Yeah, that's true. But, you know, I can only keep, stating the facts that, you know, these are high numbers. These are high numbers.
And I agree. And that's what what worries me is that, because when I'm out and about and I try to stay masked up, but you still can go in certain stores, and, you know, you just see people in stores without masks, and you just thinking, and I know the city is talking about passing the ordinance, but I'm just thinking that, and I'll give you a better scenario. I remember not too long, I think in March, earlier, I was in another town, and a woman came in the store, and the lady said, "No, you have to leave." She said, "You have to put on a mask or you have to leave." And she said, and the woman said, "But I thought," she was like, "Look, this is a privately owned store.
Yeah.
Ma'am, I need you to leave or put on a mask." And I just thought that was really, you know, I liked that. But I just get the feeling here that you can walk into most stores, and if you have a mask on, great. And if you don't, it's okay. Yeah. And who am I to say? But I just think, I don't know if we as a community have truly internalize what 500 to 100,000 really means.
Yeah, you're right. It has little relevance to the person, say, who's not involved in medicine like I am, or your great interest in it, and John's great interest in it. But you're absolutely right. But I think even more pertinent is the numbers for the hospital. I mean, almost, lack of critical care beds in these hospitals, surrounding hospitals, are numbers that really concern me more than the population numbers. That's, a third or a quarter of your hospital is COVID-19 patients. That should be, those should be numbers that worry people.
I just know about a month ago, I was telling someone that I didn't know anyone really personally, closely related to me that even had COVID really. That was just like a month ago. But within this past month, quite a few people I know that I'm very close to, they have COVID, they have had COVID, or someone in their family has had COVID. So just in the month, it seems like for me personally, it has impacted a lot of people in my circle. And that really changes the dynamics.
Yeah, and you look at, the Georgia Public Health website, you can see that graph just climbing, steadily up. And there you go. That's exactly what's happening.
Well, I was going to say, I wonder, with the numbers like they are, if there are many people left who don't know somebody who's been affected by COVID. And Greg, like you, I've had quite a few people just in the last 2 or 3 weeks in my circle that have had COVID themselves, or have had family members die of COVID. And that has definitely changed this past month than previously, at least for me. And then you're saying that's similar with you. So what is it, you just got to ask, what is it going to take to get people to wear masks, and why is it such a big deal? I mean, I have yet to, I didn't understand it in March, but boy, I really don't understand it now.
Well, I was given a graph today, a multi situational graphs from an acquaintance of mine that was showing statistics don't bear out that masks work. And there was a variety of different places, international graphs, local graphs, United States. But, when you just have a simple number like that and say masks don't work, well, were these people wearing masks in a restaurant? Were they wearing masks in a bar? Were they not wearing masks outside? You can take any statistic and make what you want of it. But it's going to take people realizing that this is highly transmissible, contagious, and people may die from it. And we just have to keep emphasizing the fact that it's easy to wear a mask. You can reduce the transmission by wearing a mask. They're not 100%. None of the masks are, except for the N95s. But, they do reduce transmission. We do not say they're 100%, but there's ample evidence that I've seen that do demonstrate you're going to reduce some of the transmission. It's not a perfect solution.
But even with that, I guess right now I'm at a point where I think there's a lot of confusion, and I am myself fall in that category. Like, I wear a mask, I order a mask, but now I hear this, it has to be multi-layered. And then I'm asking myself, exactly what does that mean? Because if I order, I guess, some of these common masks, are they double layered? How do you really know so things of that nature? And then two, lately I've been hearing that it's not so much transferred through touching of objects as it is airborne.
Yeah, you're right. There's been multiple studies that they've able to detect viral particles on, hard surfaces. They've not been able to culture it or grow it. And they're inferring from, previous viral infections, particularly flu, where we know flu can easily be transmitted from hard surfaces where you touch a table or a desk or something and you rub your eye. And they're inferring from that. Most viruses are transmissible like that. So the experts, the virologists, are assuming that COVID is easily spread like that. There's not been a lot of science behind that yet. They have not been able to determine that it is spread like that. Just because they haven't been able to determine it, it doesn't mean we should let our guard down. It seems very reasonable that almost all viruses can be spread like that. Why can't the coronavirus? So, it just makes sense to be mindful of that and keeping surfaces clean. And then again, because there's not a lot of science, or there's variable science about masks, but it's so easy to wear a mask. Some people just aren't going to be dictated to or, asked to do anything. There's some people that are just like that, but it's just so easy to do.
All right, we need to take a break here, but we will be back with much more conversation, so don't go away.
For 50 years, Georgia Highlands College has been a community that takes charge. At GHC, we have a mission to provide access to an outstanding education, meeting the career needs of the region, and helping our communities thrive. Every student we graduate becomes a celebration we never forget. We are more than Chargers. We are Chargers taking charge for 50 years and beyond.
Welcome back to Community Watch. We're having a conversation with Dr. Gary Voccio, the Director of Public Health for Northwest Health District. 10 counties, 10 big counties, including Floyd County, talking about COVID and related issues. And Dr. Voccio, before we get too far away from it, we wanted to remind people where to get tested. And I know this because I just got tested again. I think this was my third time a week ago at the fairgrounds. And Greg, I think you get tested 2 or 3 times a day, don't you?
I've been tested about 6 times. Yeah. I just think you have to be. I think you just can't, you just have to stay on top of it.
Yeah. Well, we are testing every day, except we do not test on the weekends, and I will get into that briefly why. But we're testing it at Walker County, Bartow, Floyd County, and Paulding County, and Catoosa County, and Gordon County. There are variable dates where that is done, but we're doing testing every day, and anyone can go get tested at any of those sites. Any resident of Georgia, we've done a lot of other out-of-state individuals too. But Walker, Bartow, Floyd, Paulding, Catoosa County, and Gordon County all have testing, in Dade County. 8:30 to 4, depends on the temperature. If it's below freezing, we have to wait until it gets a little warmer, usually by 11 a.m. 8:30 to 4, most days, unless the weather is inclement. It's free. The other counties that we do not test, we went from 10 counties to 7 counties. The other counties that are not testing, the 3 counties that we don't test is Chattooga, Polk, and Haralson. And the reason is we just had to reduce we get better and for economies of scale, et cetera, cost effectiveness, we had to close those down. But we realized that we did that and realized that we were going to have to do it. But those citizens of those counties can go to any county and get tested at any site. However, those other counties that don't have PCR testing or nasal swab testing can always go to the health department to get a Binax 15-minute antigen test. Those are available at all the health departments also. They just can call ahead so the nurse can be prepared for them, and they can get a Binax antigen test. It's free. If they are negative, they need to be symptomatic. They need to have symptoms, and that could be lack of sense of smell and taste, fever, of course, shortness of breath, cough, any GI symptoms. They can be related to COVID. So they can get a Binax antigen test at the health department for free. It takes 15 minutes. However, if it's negative and they're having symptoms, they will need to get a PCR, okay? If it's positive, it's positive. But those are available also at any health department, the Binax. But the PCR is much more sensitive, it's much more specific, and we recommend the PCR for most individuals. So they can get health department Monday through Friday, 8:30 to 4 at our specimen collection sites in those 7 counties.
Now, Doc, does the Binax test, is that the one that just tells you if you have the antigen in your body or has been in your body?
Yes, well, no, that's antibody.
Okay.
That's an antibody. The antigen test tests a virus particle that may be in your nose or your pharynx. And it's tested on a little card. They do a nasal swab. They put the card, they put the little swab in a little, looks like a little paper envelope. They put 6 drops of antigen tester on it. They wait 15 minutes. And if there's a color change, it's positive. If it's negative and you're having symptoms, you need to get a PCR. Because those have a lot of false negative results about 15% of the time. But if it's positive, it's positive.
Now, I know a lot of medical professions or hospitals or urgent cares or whatever are doing testing now. Are most of them doing PCR tests? Or
Yes,
okay.
yes, they are. Most of them, all of them are almost, yes, they're doing PCRs. Yes, they're just more sensitive and more specific, and they have the need to know if it's really somebody with COVID. Because the antigen test, like I said, the quick test that you're seeing are reported by many, many studies, about a 15% false negative rate.
That seems high to me. Is that high?
No, that's average. That is high, but yeah, that's about average. Yeah.
So are we seeing changes in the age of folks who are positive with COVID? I know we started with primarily seniors, mid 60s and over. I know that was a group of major concern. Is it skewing younger now?
Yes, the average age in Floyd County is 39.
Wow. So for that to be average, then we have quite a few much younger than that.
Oh, yes. About 30% of our cases here are between ages 25 and 34.
Mm. But even that, 25, 34. So somewhat when we see all these surgeries at schools, are those mostly teachers?
Yes.
Okay.
Yes.
Because I do know you see a lot of.
Yes.
Yeah. Okay.
Yes, I've talked to the school superintendents frequently, Greg, and that's their main problem is the teachers are coming either quarantined or infected. That's why the schools are closing. Yes, that's exactly right.
Well, I don't know, we'd been reading, and I guess we're still reading, and I don't know if we have data to back this up locally, but we've been reading nationally that individuals of color are being affected at higher rates than others. Do you happen to know if that's the case locally as well, or?
Well, statistically in Floyd County, it's approximately the population of each ethnicity. Out of the 84 deaths here in Floyd County, 73 have been white people, 10 have been black people, and 3 have been unidentified. And really, statistically, it more or less matches what we see in our population. Yes, nationally, I think the Black, African American, and Hispanics, in some places have higher positivity rates, and it's attributable, I think, because they can't do Zoom conferences as much. They're in industries where they have to be person to person. They do have other medical comorbidities. So yeah, I think that's very accurate.
And I think you just said it, Doc, comorbidity is that I think it speaks to the overall health care of people of color in general, that, a lot of African Americans suffer from treatable and preventable diseases that are underlying mix that with COVID, it really creates this very
Oh,
deadly
absolutely.
situation. Yeah.
You know, there's more hypertension and heart disease in the African American community. Probably higher. I do not know this statistic, but higher rates of diabetes possibly. So you're seeing all that too.
But I am curious though with because I don't know, and you can tell us what is. I know we need to wear masks, but what is the one message that we really need to be pushing? If because involved meeting with other people in other organizations, you have a lot of people talking, but what is the one core message we should be pushing when we're talking to people about how to prevent or how to delay or slow down? What is the message we should be carrying out?
Well, we don't have any pill or outpatient treatment for COVID. The inpatient treatment is somewhat limited. So we have to use non-pharmaceutical interventions, or what they call NPIs. And again, that's physical distancing. Don't be in large groups in small areas. You don't want to get 50 people in a small room to have a party. I mean, that's just deadly. And these are what's called the non-pharmaceutical interventions. Wear a mask. Don't get into big groups, large crowds. It's just simple measures. And wash your hands so you don't possibly pick it up. And these are the unfortunate things. Unfortunately, it's not a pill. It's not anything that is, medicinal. It's just simple measures. And people have to be aware that the bigger the group, the more enclosed space you are, more than likely somebody's going to have COVID there and spread it to other people. Also, I see this every day. We have outbreaks, Greg. You would not believe the outbreak list that we have for Northwest Georgia. And I talk to school superintendents, people going to work when they're sick. I mean, we had an outbreak in a nursing home, 20-something people in a nursing home with COVID-19, staff and residents included. Well, people sick with COVID went to work. They didn't feel good. They went home for a day or two, felt better, went back to work. They had COVID. They knew they had it, but they felt better, so they went to work. Mm-hmm. I mean, that's. I had a school superintendent call me and say, I just got to let you know we're going to close the school down. I had a school teacher come to work sick. She knew she was sick. She had a fever and came to work. Don't go to work or school if you're sick. And these are all true stories. I know people have to work, but you don't want to transmit a virus to somebody that will make them end up in the hospital.
This the whole story of this virus is how much people care about the well-being of others, because that's why you wear a mask. I mean, it's not even to protect yourself, but to protect other people.
Yes, I know. This is easy to wear a mask for people. It's just not hard to do. And I really implore people to wear a mask, physically distance, if you can. Try to avoid large crowds inside. I mean, all the simple non-medicinal measures that we can take until the vaccine is available for everyone.
And we're almost out of time, and we didn't even touch on the vaccine situation, but maybe it's a little early to talk about that anyway. And we're going to try to coerce you to come back.
Sure.
And talk about that, maybe when we know more.
I have some information that's very limited, but we're going to have a vaccine for Georgia next week to first responders and long-term care facilities.
Well, we're out of time. Dr. Voccio, we appreciate you being with us so much. And those of you watching, we appreciate you as well. We'll see you next time on Community Watch.